Hi everyone, welcome to our YouTube channel. Do not forget to subscribe, to like, and then turn on notification bell so that you get our videos as soon as we put them out. Thank you.
Good evening to you all. Welcome to this Zoom meeting. You can call me Big Lord. I'm happy to be your host on this meeting. And the purpose of this meeting is for us to give you information and guidance on how to make the most of the new opportunity that has come forth through the care visa for healthcare assistants. Okay? Healthcare assistants can now be able to get jobs to be able to live and work in the UK, especially coming from overseas and maybe Nigeria and any other country. But our attention today will be on how Nigerians can take advantage of this opportunity as it has become available. Okay? All right. But before I go on, I would like to be clear. For the purpose of clarity, we are not a recruitment agency, nor are we a visa agency for UK visa. Okay? What we are doing is giving information about how you can follow the steps and guidance that has been laid down by the appropriate authorities so that you can all achieve your desired results. Okay? The way the UK society is, you don't need to know anybody in authority or have any insider. Once you follow the guidelines, the laid down rules, you will definitely achieve your desired results. That is why we're having this meeting, so that so many of us that are not aware or are not well informed, we can have the appropriate information so that we can follow the steps, and then most of the things you'll be doing by yourself, okay? And then you get your desired result. You'll be applying for the jobs yourself, you'll be doing the interview yourself, and then you'll be, of course, doing your visa processing too by yourself. And if you feel you need guidance, then you have to sort that out by yourself. Okay, what we are doing here is giving information and guidance so that you can follow those information and guidance and get your desired results. All right, now moving on, I'm going to be sharing the screen so that you will be able to see some visuals so that I won't just be talking and you'll be wondering where are these facts from. Okay, I'll be sharing my screen shortly so that I can show you, so that you can see from the somebody will say, hear from the horse's mouth, okay? So that you would see the information directly from the source, which you can also check out yourself and verify, on your own, okay? So I'll be sharing my screen shortly. Just a minute, let me let some more people in that are just joining us. Okay, definitely they've not missed much. All right, so I'm sharing my screen with you now, and then you can all see this is the page of the government of the UK. This is the page where the most recent information and authentic information is published regarding immigration to the UK. All right, now this is a press release that was released, and it's called the biggest visa boost. Why is it the biggest visa boost? It is the biggest because it has never been like this. It is new and it's a visa boost because before now, this visa route is only for this healthcare visa scheme is only for doctors and nurses and other healthcare professionals, okay? But now it has been expanded to be able to accommodate care workers and the care assistants and their home care workers. Now, they will become eligible for this health and care visa for a period of 12 months, and which will be open to extension. Okay, this news came out in the 24th of December. That's about 3 weeks ago. That is how new the information is. Okay, this announcement was made on the 24th of December 2021, about 3 weeks ago, about the biggest visa boost. So how can you take advantage of this biggest visa boost? Okay, you can, as a Nigerian, be able to get a job and bring your family. But we're going to go into details. Who can qualify to apply for this job? What are the requirements? How can you get this job? What are the steps to take? We'll be going into all those details as we proceed in this meeting. Now, care staff, as you can see, to be added to the shortage occupation list in response to the pandemic pressure. There is currently a huge shortage of healthcare assistants in the UK. This is due to the pandemic pressure COVID has taken its toll on, the healthcare sector, where there's so much pressure in this sector, where they require more people to come and work and make sure that they don't feel so much shortage in this sector. So there is shortage of healthcare assistants presently because of the pressure posed by COVID. And that is why they're opening the doors for healthcare assistants to come into the UK from overseas. Okay, this visa boost complements part of what they are doing to improve the workforce recruitment. Okay, now they've said that thousands of additional care workers, okay, thousands, my dear brothers and sisters, are you going to be among these thousands of additional care workers that will be recruited? Okay, how can you be among them? You need to take the step now. You need to listen carefully to this meeting so that you can know the steps to take. Okay, thousands of healthcare providers to be recruited to boost the adult social care workforce following temporary changes. Okay, these temporary changes are temporary. I want you to observe how many times temporary is mentioned in this publication. It is temporary because this measure is just to take care of this shortage that they are currently experiencing. Immediately this shortage is taken care of, there is likelihood that they will change the laws and the rules. Okay, so right now we are encouraging you to be smart about it and be ready to take advantage of these jobs when they begin to open by the end of February. I'll be telling you where you will see where it is stated that by the end of February, these jobs will become available. So to the health and care visa, to make these social care workers and care assistants eligible for a 12-month period, which later, the purpose is as soon as this pressure is taken care of, they will now fill in these gaps. Okay, there are vital gaps that are presently, making jobs to be scarce. They need people to come and fill in these jobs right now, and they need you and I to apply for these jobs so that they can fill in these vacancies that are available for healthcare assistants. There is massive shortage of carers, massive shortage of healthcare assistants right now. And because the way the England society is, there's a huge high number of the older people, high number of the elderly that needs your support, that needs help in their daily activity, that needs to be taken care of. So they need more healthcare assistants to come and do this work. The nurses and doctors cannot do this job alone. They need you healthcare assistants to come and do. So what you need to do, how you can qualify to apply for these jobs, we're going to be showing them to you right very soon. Okay, now, but we need to first finish what this publication is saying. Okay, now the coronavirus pandemic has highlighted a range of sharp shortages. Can you see? Within the social health sector, placing pressure on the existing workforce. Okay, not forgetting to appreciate what the existing people are doing. We appreciate what the current staffs are doing. We give them kudos. Okay, now this boost is a boost because it's not like this before. This boost is an opportunity for you to take advantage of it. Don't forget that it is also temporary. It is not going to continue to be available. You have to be ready if you need to take your COVID vaccine, because that is one of the most important things that you'll be looking out for you to work as a care assistant. It's not your first degree, it is not your BSc, it is not your MSc that you need to work as a care assistant. It is not any of this qualification, because the truth is, even when you want to apply for these jobs, you will be applying, and by the time they offer you the job, the training you require to be able to do the job will be given to you after they've offered you the employment. Okay, the things you need to qualify for this job, I'll be showing you all those things very shortly. So even if you are a ND holder, OND holder, even a common SSC holder, you can become a healthcare assistant, because the training you need is not the one you have before the job, it's the one they give you after you have gotten the job, because they will be giving you practical training of how they want you to deliver on the job. Okay, so the inclusion of this shortage occupation list will stipulate an annual salary of a minimum of this. This is the minimum salary you'll be offered for the role. Okay, this is for carers of healthcare, and this is the amount of salary you will be earning for this role. Minimum, you can earn more, but that's the amount the employers must offer you, and then you will be able to get your visa. Okay, so this temporary measure, can you see? Temporary is mentioned again. This temporary measure are expected to come into effect early next year. All right. When they say early next year, what they mean here, because this publication was done in December 24, 2021. So meaning next year here, what they are saying by this next year, early next year, is this January that we are now. So early next year, and will be in place for 12 months. All right. Now, providing a much needed staffing boost. Staffing boost because there is shortage, need healthcare assistance. This staffing boost that they need. While the sector deals with the additional pressure of the pandemic, at which point they will not be reviewed. Of course, to be reviewed for the 12 months. Now, the Health and Social Care Secretary, one of the highest authority in that department, have said that it is vital that we continue to do what we can to protect the social sector because there is massive pressure. They need workers in this field. Sometimes they will even be begging people to work. That is because there is massive shortage, okay? That's why they're opening the doors for people to come in from other countries to come and work. And what you need to do this work is not rocket science. You don't even need any bachelor's degree in nursing or anything. You know, the type of training you will need to perform, you will be given once you start the job. Now, this measure, put together a series of support package, can you see? It is just to support you to make sure that you're able to deliver on the job, okay? Now, some of the things you need to do to be ready to take this job is to get your COVID vaccine. Before you can work as a healthcare assistant, you must be double vaccinated, okay? You must be able to show that you've been vaccinated. You have to start that now. Once these jobs open in February, okay, you can't just be running at that point to get your COVID vaccine. It takes time to get your vaccine, so you need to get that one sorted now. And between now and February ending, when these jobs become available, there are some things I'm going to be telling you to do so that you can put yourself in a position to be employable by these employers, all right? Because you will be doing the application yourself. All we are going to do is to share the links on where you will get the jobs, you know, and then apply for them by yourself. Now, care providers. Who are care providers? The care providers being referred to here are your potential employers, those who will offer you the job, those people that you will apply to directly by yourself. These are people that will give you interviews, that will do the interview for you. These are the people that will give you the offer letter. These are the people that will give you the sponsor certificate that you need to take to the embassy to get your visa, okay? Care providers, the government has said, these care providers, a lot of them, they have not been recruiting healthcare assistants before. They don't even know about the process. They don't know how to go about it. The government has said, okay, don't worry, we'll give you opportunity. You have, if you don't already hold the sponsor's license, which you need to be able to invite and bring an employee from abroad, will allow you to apply. If you don't already hold the sponsor license in the skilled worker route, to prepare them to take advantage of our offer by registering them for a sponsorship license ahead of this implementation. This implementation is going to happen around February time, to put them ahead of this implementation. Okay? They're also talking to providers here. Now, they're saying providers who are new to the visa sponsorship will be supported through the process, okay? Through a series of engagement activities that they will be doing with them. This will be between your employers and the government. So this activity will take place between the government and your employers between January and February, okay? Between January and February. So by the end of February, your employers should be set, start employing you, and you can apply to them directly by yourself because they need to be able to act as your visa sponsor. That is what you will need to take to the embassy to get your visa. All right, now this is the most important part of the package. And I like this package because I'm always happy to share it with in the meeting, right? As care workers and carers recruited in the UK, you'll be able to bring your dependents. That means you can bring your wife, your husband, and your children, including your PC. And then you can see that this healthcare visa, it can offer you a pathway to settlement. That means you can become a citizen through just ordinary, call it ordinary, healthcare assistant job. You know, you don't have to go through the education or you want to study master, spending so much money to come and school and everything before you can bring your family. You can use this care assistant route as a way to come in, even into the UK, to bring your family or yourself. And also later become a citizen. The only condition is you have to remain employed. That means the sponsor that gave you this sponsor visa, okay, to get that offer you the job, you have to remain employed with them. That is the only condition. It is not rocket science, okay? You have to just be, currently, you have to remain employed and wish to remain in the country, all right? So moving forward, the Home Secretary, okay, has said that they also acknowledge that the healthcare sector is experiencing an unprecedented challenge. This is because of the pandemic. That is why they've made these changes, okay? So that you can allow health and care visa to be available to bolster the workforce and help alleviate some of the pressures that they are currently experiencing. You can see that this process is going to be temporary because it is just to take care of the pressure that they are currently experiencing. Once this pressure is taken care of, it is temporary, and they will probably or most likely change the law back to how it used to be, that allows for only nurses and doctors, only qualified people that have all this degree and training, that will allow. But with this healthcare assistant job, you don't need any kind of training. The training you need to do the job is the training that they will give you after they offered you the job. And the truth is that apart from you being able to communicate in good English and getting your COVID vaccine, there are some other things that you need to be able to do, because there's going to be an interview they're going to conduct for you after you apply for the job by yourself. After we share these links for you, you'll be able to go to, I'm going to be going there very soon. You can see these things yourself, all right? Now, the Minister for Care, one of the highest authority in that area, has said that they know that social care staff have done a phenomenal job in delivery care under the most challenging circumstances. The pressure is much, and they know that people are tired. This is one of the other reasons why they're opening the doors for help to come from abroad. We want people to come from abroad to come and help, the team that has been working tirelessly to salvage the situation, okay? They said they recognize the challenges the workforce has faced with ever-growing demand for services, combined with the challenges of the pandemic and the existing staff shortages. And you see, that they acknowledge that there is existing staff shortage. That is why they are opening the door for you. Please take advantage of this opportunity. Prepare yourself, get ready. And if you even have to do some volunteer work, okay, so that you can get some experience as a caregiver. Most of us as Nigerians at some point, we have taken care of our elderly ones, people who are sick, recovering from surgery at one point or the other. Those are basic things that you need to be able to take care of somebody as a care assistant. Although the only difference is that you'll be taking care of a stranger and you'll be getting paid for doing this, all right? And the good thing is that you don't have to remain a healthcare assistant all your life. The UK system allows you to progress in your career. You can progress from being a healthcare assistant to a senior healthcare assistant, then from that to a phlebotomist. A phlebotomist in Nigeria, you know them as science lab technicians, people that take your blood to do your typhoid and malaria test. Then from there, you can progress to a nursing associate. From there, you can progress to a nurse or a mental health nurse. So you don't have to be a healthcare assistant. It's a career pathway you can follow, and you can become a professional in the healthcare sector. Okay. Now, can you see that COVID vaccine is important? And they are saying here that you must take your COVID vaccine. So don't wait till when you're applying for these jobs by February ending before you take your COVID vaccine. Go now, and if you're not taking your vaccine, make sure you take a double jab so that you can go ahead and be sure that you are ready to take on this job application when they become open by February ending. So for the purpose of this meeting, whenever I refer to job care assistant, what I'm saying is that I'm talking about a care worker, a carer, a home care assistant, a home carer, and a support worker. Now, in summary, a care assistant can be working in a hospital. A care assistant can work in the hospital. The care assistant can work in the hospital setting where you'll be taking care of someone that has been through surgery, someone that was at one any point or the other, maybe recovering from a sickness, or it may be an older person that needs attention and care. That's a hospital setting. In some cases, it's palliative care. In some people, it's end-of-life care. In some cases, these are things you'll be doing as a healthcare assistant. Okay. Secondly, it could be in a care home setting. Everybody, there's a home where you have older people or people with some sort of health challenge, and you have to take care of them. Under the supervision of professionals like nurses and doctors or other healthcare professionals. In another setting, we have the likes of the missionary healthcare assistant that you'll be moving from house to house. That's a community setting. You take care of Mr. A, you finish, you go to Mr. A's house and take care of Mr. B, just to make sure he's supported with daily needs. Okay? Another setting, we call it living care. As a healthcare assistant, you'll be living with the patient just to give them close observation and monitor their health situation. You can give reports to the visiting nurse whenever they come visiting. Okay, you make sure they take their medications, you make sure they eat their food, and these are things that you will do as a healthcare assistant. All right. Now I'll be sharing with you an example of the page. Okay, when this job starts to come on in February ending, this is an example of a link we will share with you so that you can do your application by yourself. Okay, take for instance, this is a job application It's been advertised. This is the role of a care assistant in this nursing home, and this is the amount they've indicated they will be paying. Okay, they have told you that this is what the opportunities you have if you take up this employment. All right, now this is what they have told their requirements. They've said that we are looking for people who have experience caring for other people, whether be it grandparents, siblings, or in a formal care setting. Can you see? The requirements is not cumbersome. It is just very straightforward. And they also offer you career progression, meaning you can progress and undergo ongoing training, okay, while you are working with them. The way it works is that you can be full-time. Of course, this work is going to be full-time because you're going to be given a sponsor's visa, all right? It's going to be probably a 12-hour shift, day shift, or night shift. So this is an example of the type of package or contract you'll be handed over, okay? Right now, you also have to know that when you take on this job, you apply, and when you apply, they will invite you for an interview, the type of interview that will happen like a Zoom meeting, like this one you are having. You apply for the job by yourself, then you ask me, how can I pass an interview? Those are part of the things we'll be helping you with. A lot of things that you need to know so that you'll be able to do well in your interview. You'll be able to answer the questions from the interview panel, and you'll be able to get the job. Okay, and a good example is during the interview, the interviewer wants to see how passionate you are. They're looking out for skills. They're looking out for personal characteristics that you have, okay? For qualification, regardless of, they don't need your BSc. As a matter of fact, even if you are a nursing graduate, that nursing graduate, as long as it is the role of a care assistant you are applying for, okay, they have to put that certificate, whatever certificate you have, aside. Now, what they are looking out for is your compassionate, how compassionate you are, okay? You want to check out your level of compassion, all right? You want to see how caring and kind you are. They are looking out during the interview. Are you a cheerful and friendly person? Are you willing to be hands-on with the patient? Are you willing to do personal care tasks like washing and toileting? Are you able to follow instructions and procedures? Okay, these will be things that the interviewers will be looking out for. Also be looking out for your ability to work with a team. Be able to communicate effectively. Be the kind of person that understands tasks. Be able to deliver when they ask you to do something. Are you able to carry out tasks without being without supervision? Okay, they are looking out for your ability to help your patient to experience a comfortable and stress-free life as possible, because that is your job. Okay, are you able to wash and dress patients? Are you able to serve their meal? You know, are you able to feed them? Are you able to move them around when they need help? Are you able to make their bed? Are you able to make patients feel comfortable? Are you able to monitor patients, you know, by taking their temperature and other minor things like weight and pulse and other things like that? Okay, so these are things that we're going to be sharing with you, resources that will help you to understand how to do these things. We'll be sharing with you resources that will help you to understand your role. So during the interview, when they ask you some questions, you'll be able to deliver. Because in the interview, it's going to be between you and your God. Okay, and I'm sure that God will see you through. Okay, because there is no shortcut. There is no shortcut. Okay, process has to be followed. You will apply for the role. When you apply for the role, they will look at your application. When they see your application, they will invite you on a Zoom meeting for interview. And during the interview, they'll be asking you these questions. And because you are fortunate to be on this platform, right? And we would have shared with you the resources that will help you to understand your role as a healthcare assistant. When they ask you questions regarding your role, you'll be able to answer. We'll also be sharing with you on this platform the resources that will help you understand your personal development. You will be able to understand your duty as a carer. You'll be able to understand equality and diversity. You would know that everyone is equal, regardless of their color, their race, their age, their religion, or their belief. You have to put some of our Nigerian mentality behind. You know, these are things you need to know, because the way things work here in the UK is different from the way things work in Nigeria. So you have to also understand what it means to do a person-centered care for someone in a person-centered way, meaning that every patient that you're caring for is unique, and you have to care for them according to how they want it, according to their needs. Okay, you have to meet them in their needs, because they will let you know how they want to be taken care of. Okay, you have to be able to communicate with your patient in the right manner. You have to maintain their privacy and their dignity, because you'll be taking care of them, and you'll be exposed to part of their personal information. You have to learn how to maintain their privacy and dignity, how to give them fluid and maintain their nutritional balance. These are some of the resources we will share with you so that when you are confronted with such questions during your interview, you'll be able to do well for to the interview panel. Then you'll be offered the job. We'll also be sharing resources that will help you understand safeguarding of adults and children. Okay, we also share information and resources with you that will help you understand health and safety, because your health and personal safety while on the job is important. We also share with you infection prevention and control, how to put on your apron, donning and doffing, and all those things that you need to know, how to wash your hands effectively, and how to prevent cross-contamination and the likes of it. So these are resources we will share with you so that during your interview, you can do well and you can meet the expectations of the interview panel, and then you will be offered the job. Like I've told you, we are not recruiters. What we do is to guide you and give you information. And with this information, you will leave you to your fate. And by the grace of God, you will be able to impress the interviewers, and then you'll be able to get a job. Like I said, it is not your first degree, it's not your qualification that they're looking for. They're just looking at for some of these things that I've mentioned, how compassionate you are, how passionate you are, how much of a good heart you have to be able to put other people's feelings ahead of yours, how caring you are. Those are the things they're looking at for. The true skills, the real skills that you need to perform on this job, giving you after they've offered you the job. And then there's what they call induction and on-the-job training, okay? When you get the job, the on-the-job training they will be offering you is what will make you understand how they want you to deliver on the job. That is when you will now be given the peer certificate by them after they've given you training. The peer certificate is what is accredited by the NHS after they've trained you by themselves and they're giving you the job, okay? So it is also important that you know, okay, as Nigerians, we have a good chance because we speak English, all right? Compared to some other applicants that will be coming from Asia and India. But I must tell you that speaking English is not enough. You have to be able to show your proficiency in English, all right? Because speaking English doesn't mean you understand it. How do you understand to deliver, how to carry out a task, okay? You have to understand that you have to be able to show that you are proficient in English, in communication, in speaking, in understanding, and in when the task is given to you, then you can interpret it and deliver, okay? Between now and when the February ending, let me show you where it is stated clearly. This is it. Stated clearly that it is February ending, that, okay, this is it. All right, so this is a letter that was issued, okay, to the Migration Advisory Authority, Advisory Committee. This letter is very recent. It's 7th January 2022. As you can see, can you see? I'm not the one that wrote the letter. There, can you see? I'd like to thank you for the rest of the committee for your annual report, for bringing forward your interim recommendation that we should add care workers to this shortage list. And therefore, it's to all, can you see the letter? Can you see? It will all come into force in February 2022. So by the end of February, everything will come into effect. And by then, the jobs will start rolling out. All right? So it's also important, let me look at, it's also important that I let women, I have much respect for women. You are our mothers and we love you, okay? This job is very, very, women stand a higher chance of getting this job more than men. That is not to say that my fellow brothers too cannot apply. Men, you can also apply. I'm only saying that if you are applying, if you want to apply as a couple, I think it's better you put your wife forward, because you as a husband can come in as a dependent of your wife, okay? The reason why I'm saying that is it's easier for a woman to take care of a man and a woman than it is for a man to take care of a woman and a man. Let me say it again so that you understand me. It is easier for a woman to take care of a man and a woman than it is for a man to take care of a woman and a man. I hope you understand what I'm saying. If you don't get it, then forget about it, okay? So now, going forward, all right, I want you to get the experience you need. Even if you need to go and work as a volunteer in a hospital environment, so that you can understand what it means to care for somebody that's probably recovering from surgery, moving somebody in the wheelchair, from wheelchair to bed. Although the way things work here, you won't be carrying anybody with your hands. And equipment that will be doing all the moving and handling. Okay, these are things they will be training you before you start the job. Even as a nurse in Nigeria, I can guarantee you that all the state of the art, the best equipment they use in Nigeria, okay? in the best hospitals in Nigeria, you even if you have the training in those equipments on how to use those equipment, and you get here to work as a healthcare assistant, you come here to work as a healthcare assistant, they will still train you on how to use modern equipments they have here, moving people maybe from wheelchair to bed and the likes, okay? That's what I'm telling you. And whatever the type of qualification you have, they will still train you after they offer you the job. That is what they call on-the-job training and induction that they must do for you after they offer you the job, okay? So I've told you, one of the most important thing you need is being able to communicate in English language. So if you have a BSc in any course, whether accountancy, whether business admin, whether, doesn't matter what your foundation is, you can do this job. The advantage you have if you have a BSc over someone that does not have a BSc is that with your BSc, you may not need to do IELTS. All you need to do is to provide evidence that your language of instruction for that BSc was in English language, and then you may be waived from taking IELTS. But if you have ordinary senior school certificate, WAEC, you will have to do your IELTS to show that you understand English and you're able to communicate and you're able to understand tasks that is given in English language, okay? Now, going forward, it's important that when we give you resources on this chats group, please make sure if you have any challenge with them, contact our admin, because the importance is that during your interview, there won't be anybody there to help you. It is these resources that you have been able to study and understand that will help you to answer some of the questions that they will be giving you. And also, if you can work as a volunteer in any hospital where someone is recovering from sickness, or and you can take care, then understand that, is this role for me? Because the truth is, you have to have passion for taking care of someone that is not your relative, someone that you don't know from anywhere. You have to be able to do this thing. Forget that it is just a job, but this will be something you will do on a daily basis for people you don't know. So you have to know, is this work for you? Is this something you can do? Can you go out of your way to take care of somebody that you don't know at all? Okay, so these are things you have to try out and see whether you can cope with. And like I've said, it is not something you have to do for the rest of your life. You can progress. You can, from being a healthcare assistant, become a nurse, at the end of the day. And this is not something you have to leave your job for. You can be working, and at the same time, you can be learning on the job, and they'll be giving you training in your workplace where you'll be progressing and you'll be growing from a healthcare assistant to senior healthcare assistant to nursing associate, then to a nurse. Okay, this is progression that you can follow through and become someone better in your career. All right. Okay, the way the UK system is, you do things by yourself. Your fate is in your hands. Okay, and you have to, once you follow the guidelines, you don't need any. You don't need to know anybody. You don't need to give anybody money. Before you get your desired result. Just follow these laid down rules, and you can see that you get your desired result. Okay, this is what I want to share with you now. February 22, that is when e-jobs will start rolling out. And when they roll out, we will share the links for you, okay, so that you can apply for the jobs by yourself. And then you will have been prepared because of the resources we are going to be sharing with you. So you'll be able to face any interview panel in this world. And I trust my Nigeria people, they carry last. All right. So very quickly, I want to encourage us, if you need to take your COVID vaccine, please go ahead and take your COVID vaccine. Let COVID vaccine not be a stumbling block for you to be able to apply, because those are very, very important things they will need. Okay, if you don't have COVID vaccine, you can't be qualified to take care. You have to protect yourself and people around you. All right, this is a moving train, and I encourage you all to start the process now. Okay, if you want to work and live in the UK and come in to live and work as a healthcare assistant, you want to live and work in the UK, you want to roll with the big boys. Okay, you have to do your everything quickly so that you won't be running kata. Okay, and be up crying that time is over or the opportunity has gone. All right. So guys, I really want to appreciate you for coming on this platform. I want to thank you all for this, for being a wonderful audience. And then we are going to be seeing you all in the admin group if you have any question. So from next week, we will be uploading information, guidance, and resources on how to understand your role, information that will help you. And as soon as more information are available, we'll make them available to you. Thank you all for being a wonderful audience. I want to wish you a very wonderful weekend, and God bless you all. Thank you so much. Bye. Bye for now.